Hello, in this video we will be role-playing a vaginal birth with a substance-abusing mother. We will also be talking about the expected findings in her baby. This is table 14-3 found on page 260 in our textbook. This table identifies common addictive drugs and their effects on the fetus or newborn. Drugs that are commonly misused during pregnancy include tobacco, alcohol, cocaine, marijuana, amphetamines, barbiturates, hallucinogens, club drugs, heroin, and other narcotics. Polydrug use involving multiple substances, such as alcohol, tobacco, and illicit drugs, is fairly common and contributes to the risks a pregnant woman faces. Drug use during pregnancy, particularly in the first trimester, may adversely affect the health of the woman and the growth and development of the fetus. The following video is intended for mature audiences only. This video is strictly for demonstrational purposes. Viewer discretion is advised.
Deficient fluid volume related to blood loss after birth, as evidenced by the QBL of 640. Patient had tachycardia during the little altercation that we had, hypotension.
Okay, we're gonna help you out right now, okay?
And has VO2 of 89%, which is now under control.
The doctor's coming right now, okay? We're gonna help you out.
Calm down.
I'm right here, madam.
Can't calm down.
You're able to take those
Relax
drugs,
and
you can
deep
calm
breaths.
down.
Okay, let's see.
It's okay, Mom.
Yeah, also we can reach this.
Do you want me to hold your hand?
Can we? Yeah. If we just like get a feel. Anything's like
Doctor.
follow.
It's okay, you got this.
Relax. Relax.
Okay. The last two.
Baby's crowning.
Do you want to do one more?
When you push, try to push with your contractions.
Hello, can you start helping me push?
Try to attach.
Try to concentrate, try to push with the contractions. Just try to focus. You got this, Sam.
I
Good
need
job.
you to push.
I'm trying.
Trying for another fake or trying to have this baby out?
You're doing good, Mom. You're doing good.
There's only one happening today.
Try to concentrate, okay?
I see the head, come on.
Okay.
Push
You
it.
got this, you got this. Good job. Good job.
Okay. I need to feel like how
Good for
You're
that.
almost
baby
there.
nurse.
You're almost there.
Okay. Is there anything
Okay, the baby's coming
Finally.
out. Little baby girl. Let me just start off for you, okay?
Are you in any pain?
Yes.
Nurse,
Skin with the baby.
only Toradol, Tylenol, no Stato, no morphine, no narcotics. I'll put it in the order. Yes, did you give that to you? No.
It doesn't matter.
Go ahead and look at the orders.
It includes myself.
The nurse performs an abbreviated systematic physical assessment in the birthing area to detect any abnormalities in the baby. Here she is checking the baby's head. The head should be assessed for presence of molding, and sutures and fontanelles should also be palpated. The nurse observes the baby's nares for flaring, and as the newborn cries, inspects the palate for cleft palate. The nurse looked for mucus in the nose and mouth and removed it with a bulb syringe off camera. The nurse inspects the ears of the baby and makes sure they are in alignment with the baby's eyes. Here we can see she is palpating the baby's clavicles to make sure there are no fractures or abnormalities. Now, she is assessing the baby's brachial pulses and will assess them for 1 full minute. Now the nurse takes a look at the baby's genitalia, which appears to be normal. For a female, she is now palpating the baby's femoral pulses and will also do so for 1 full minute. The baby's skin should also be inspected for discoloration, presence of vernix caseosa and lanugo, or any evidence of trauma and desquamation. She is now assessing the baby's feet for presence of wrinkles, which indicate fetal maturity. She is also counting the baby's toes. The baby has all 5 toes and has 5 fingers, and the baby shows signs of fetal maturity. Now, she will be flipping the baby over to inspect the baby's back. Now the nurse is going to palpate the back of the baby's head, and we will also see that she's going to palpate the spine of the baby. The spine should be straight and flat. The base of the spine is examined for a dermal sinus. A nevus pilosus, which means hairy nerve, is occasionally found at the base of the spine in newborns. It is significant because it is frequently associated with spina bifida. A pilonidal dimple should be examined to ascertain that there is no connection to the spinal canal. Here the doctor is auscultating the baby's heart and breath sounds with the bell of his stethoscope. He will auscultate each for 1 full minute. A normal baby's heart rate is between 110 and 160 beats per minute. A normal respiration rate is 30 to 60 breaths per minute. Some abnormal findings we can expect to find in a baby born to a drug-abusing mother would include congenital abnormalities, low birth weight, fetal alcohol syndrome, drug withdrawal symptoms including tremors, fever, chills, irritability, and seizures.
Hey guys, it's Raul. I hope you guys enjoyed the video. It was very fun to do, and I had a lot of fun recording it and acting it out. So hope it was very entertaining for you guys. Now for the nitty-gritty part is the nursing process. So we'll be talking about ADPI and its components. My part to be talking about is A, for assessment. As you can tell in the video, she is in active labor. She is in pain. At this moment, we're going to be assessing her vital signs, her pain level, assessing INOs, assessing, how much blood is coming out, all the appropriate measurements to be taken. The last time she was medicated, have the drips been started? She upon chart review, she is a substance abuser and a history of substance abuser. So, we want to go ahead and also assess, baby once, baby is born. So, I don't want to give away too much information. We'll be talking about that a little later on. So that was my part of the ADPI. The next part is going to be the D part, which will be brought to you by Aliana. So, hope you guys enjoyed it. And Aliana, take it away.
Hey guys, so I'm going to be talking about the letter D in ADPI, which is diagnosis. Clearly, based on the video, we know that mom has a history of substance abuse, which also means that she has a low pain tolerance. And clearly in the video, mom is in a lot of pain. So her nursing diagnosis would be acute pain related to vaginal delivery, as evidenced by patient yelling at the nurses and doctor for better pain meds. I don't want to share too much information in regards to planning and the interventions, so I'm going to give it away to Wendy, who's going to discuss letter P in ADPI. Take it away, Wendy.
Okay guys, so I'm going to be doing the planning part for that ADPI. So when planning, we want to develop a comprehensive and individualized plan that addresses the specific needs of the mom. So this includes providing emotional support and encouragement during birth. So as we know, during birth, this is when the mom needs the most support, the most encouragement, and she might not have that. She might not have someone next to her to give her that kind of support. So this is where we can come in and give her the support that she needs, hold her hand, tell her that everything's going to be okay, just provide her with the support that she needs during this time. We also want to develop healthy coping mechanisms to manage her stress and her cravings. We want to plan to manage pain effectively during labor, and we want to utilize non-pharmacological pain management techniques such as breathing exercises, relaxation techniques, guided imagery, really anything that can help her ease her pain during the process. We want to initiate early breastfeeding and bonding if it's desired by the mother. And also, unlike in the video where the doctor and the nurse are judging her, we actually want to provide a judgment-free, safe, and positive birthing experience for her. Because as we know, mothers who have a substance use disorder, they already feel judged by the world. They already feel judged by the fact that they use substances. So we don't want to add on to that judgment. We just want to give her a safe environment where she can feel okay, not judged when giving birth. And that's it as far as the planning goes. I'm going to go ahead and hand it off to Fatima for the next part.
Hi, my name is Fatima and I will be discussing the I in ADPI today. I stands for implementation. Here we begin to implement our plan of care as Wendy has mentioned above. We will monitor vital signs, assess pain level, and administer any medications as ordered with PRN medications in between as she deems necessary within the ordered time frame allowed. We will be making sure to use appropriate medication orders that will not be putting her at risk for her substance abuse. Unlike that cute nurse in the video with the braids, you want to make sure that you give patient-centered care, making sure she has proper support and resources for any help, not just continuing to be dismissive throughout her care. Speaking to the social worker for assessment of safety for mom and baby. Referrals to outpatient programs, therapy for mom's well-being will be carried out as well. Keeping her needs met and comfortable during this difficult time are essential in keeping her recovery. Educate mom on the importance of bonding and breastfeeding will also be carried out. Document all discussed interventions as they are done. Here we will continue to discuss the E in ADPI, which will be followed by Jackie.
Hey guys, so my part in ADPI is evaluation, and this is the final step of the nursing process where we want to determine whether after the application of the nursing process, the patient's condition has improved. So in this case, I would say that the patient's condition has been stable. She did have a vaginal birth with no complications. She experienced a second-degree tear as the baby's head was crowning. PRN pain medications were given to the patient already, and since she does have a history of drug abuse, we do want to make sure we don't give her any opioids. We would just want to keep monitoring the patient's vitals in this stage and make sure she's comfortable. So this is our QSIN. And in substance use disorder, many individuals don't seek medical attention until it's too late and they have health issues, and most never receive medical attention. That's why it's very important to not judge substance abusers and learn to identify individuals with substance abuse disorders. So some PCC includes making sure the patient has a safe living environment that supports both a healthy pregnancy and recovery from substance use disorder. We also can encourage counseling that can help pregnant people engage and remain in treatment by enhancing their coping skills. Pregnant people who have substance use disorder need information about their options for pain relief during labor, delivery, and the postpartum period, so that is very important to provide to them. We can also help connect pregnant women to the resources they need. This includes financial needs, housing, counseling needs, and knowing where to refer for further treatment in their local area. So for teaching patients, we have to keep in mind that individuals with substance use disorder often display poor dietary choices, which can result in deficiencies of essential nutrients. So addressing and educating patients about the importance of maintaining a healthy diet is very important. We can encourage a healthy diet comprising of fruits and vegetables. We can also teach the patient about staying motivated and active and having them engage in healthy activities that they enjoy to help stay motivated in their treatment during pregnancy.